And now, a tennis conversation we call Brace Yourself, presented by First Serve Tennis Center.
My name is Rich Michelson. I am a doctor of physical therapy, and I specialize in treating orthopedic and sports injuries.
Did you go to an accredited school for that, or did you get a certificate off the internet?
I went to Creighton University in Omaha, Nebraska.
What should active people, like tennis players, do for themselves when they encounter these setbacks?
I would say follow the RICE protocol. And by RICE, I mean rest, ice, compression, and elevation. These four things can really make a dent in your initial pain and swelling, and that might be enough to get you back up to speed.
What advice do you have for so-called weekend warriors who want to brace themselves for knee or ankle or elbow issues, etc.?
The most important thing to remember when it comes to brace is fit. If your brace is sliding up and down and it's not real secure, you might as well not be wearing it. On the other hand, if it's so tight where you're feeling some numbness or pins and needles going down your leg or your arm, then it's too tight and you could be doing more harm than good.
When tennis players come to you because of tennis elbow, how confident are you that you can help them?
100% confident. Tennis elbow is one of the more common afflictions that I see in the clinic, and I am very experienced in evaluating and treating that specific injury and getting you back into the activities that you love.
What about knee and ankle issues? How likely is it that physical therapy is going to help?
Very likely. As a physical therapist, I will evaluate the range of motion and strength of several joints and give the best treatment plan to remedy any deficits that we see in those areas.
Which injuries do you think are more likely to be recurring, and what advice do you have for people who struggle with a recurring condition?
I would say that calf muscles and hamstring muscles tend to be the nastiest when it comes to restraining them and feeling repeat pain and repeat symptoms. The best way we have to treat these recurring hamstring and calf strains is to address any deficits in range of motion and strength, as well as what we call proprioception. And by proprioception, I mean how well the muscles are communicating between each other. So they're applying force in the right way at the right time to minimize stress through the problem areas.
Well, Dr. Michelson, we want to thank you for coming in today. One last question. Who is your favorite tennis player of all time?
McEnroe.
Try again.
Nadal.
Nope.
My dad.
Very good.
The more you know, the more fun you can have. First Serve Tennis Center, 1500 Riverview Drive, South Sioux City, Nebraska. We're serving up fun for life.